Hi everyone, and thanks for tuning in to my video logs. My name is Dylan. I am 32 years old and I'm from the Chicago suburbs. And most of you know me because I am in a bunch of Facebook groups for a condition called pudendal neuralgia, in which I suffered for 7 years. Pudendal neuralgia is pain in the distribution of the pudendal nerve. The pudendal nerve is the main nerve roots in the pelvis that arise from sacral roots 2, 3, and 4, and it controls the pelvic floor, bladder, and bowel. And I was struggling for many, many years with stinging, stabbing, shooting pain in the left pudendal nerve distribution. I tried many treatments. I went to physical therapy, did injections, lifestyle changes, diets, standing, radical non-sitting, different cushions, and I still have very specific left-sided pudendal pelvic pain. After 7 years of suffering with pudendal neuralgia, I decided to, in March of 2020, have a very controversial surgery called pudendal nerve decompression surgery. And what that surgery is basically they sever some ligaments and go in to clear away scar tissue from the nerve in the most of the pathway. I had a very invasive surgical procedure. There are different techniques for surgical procedure. A lot of doctors decide on different surgical techniques. In Europe, they take more of a laparoscopic approach, whereas in the United States, they tend to take a transgluteal approach, which is the most invasive approach, but it gets a lot more of the nerve than the laparoscopic approach. The laparoscopic approach actually gets a little bit more at Aclox canal and clears a little bit of the scar tissue in an area that transgluteal might not get to as good, but different techniques are used in different locations. Pudendal nerve entrapment syndrome is very controversial, in which a lot of people argue that pudendal nerve entrapment syndrome doesn't exist, that everybody has scar tissue around their nerve pathway, and that is not the cause of pain. However, I was at the end of my road and I wanted to try anything and everything possible, so I decided to go with the surgery. So I flew to Phoenix, Arizona to have surgery with one of the best surgeons in America, Dr. Michael Hibner. He's an amazing doctor. And for those of you who are considering having pudendal nerve decompression surgery, I would highly suggest that you do a lot of research on the doctor, on the surgical technique. The surgery outcomes are really divided. They say that 70% of people experience at least a little progress, but the progress can take up to 2 to 3 years to fully see progress in any healing improvement. I am today 1 year and 5 months post-op. My journey is a little bit more complicated than simply pudendal neuralgia. In October of 2020, I also discovered that I have multiple vascular compressions. So basically, in various parts of my body, my kidney, my ovarian vein, and in my iliac vein, I have venal compressions. So basically, the arteries are compressing the veins in certain spots, and my blood flow is not as well as it should be in certain areas. The main one being my iliac vein. I had a 74% compression on the left side, which is the most common spot for the iliac vein to have a compression. The syndrome is called May-Turner syndrome. The kidney vein compression on the left is called Nutcracker syndrome. So when I discovered these vascular compressions, I knew that there was a lot more systemic issues going on within my body. It really made me stop and think, there's really more to my case than just simply having a nerve entrapment. I have seen probably in the double digits worth of specialists in 7 years. from neurologists to gastroenterologists, cardiologists, dietitians, physical therapists. I can keep going on and on and on. And everybody was very puzzled by my left-sided neuropathy symptoms. Not only did I suffer from the left-sided pelvic symptoms, I suffered also from like the entire left side of my body was central nervous system wind up. I had a lot of weird sensations on the left side of my body, including my upper body, but mostly my lower body, my legs, my pelvis, my glutes, even sometimes lower abdominal pain. Post decompression surgery, some of my symptoms were getting worse. I did have some fainting episodes that really scared my parents, and that prompted me to look into the vascular compressions. And there's really no good treatment for these vascular compressions other than to put a stent in, which I had a left-sided iliac stent put in. Other than that, the really only other intervention for these vascular compressions is surgery. And sometimes for the Nutcracker syndrome, if it's bad enough, people have an auto transplant, which means that they take out the left kidney. Thankfully, my Nutcrackers is only moderate. It is not that bad to consider surgery. But the main thing that I discovered was that I have what's called Ehlers-Danlos Syndrome. It's a connective tissue disorder. The most stereotypical presentation for Ehlers-Danlos Syndrome is overly flexible and joint dislocations, which I have neither of those things. I am not flexible and I do not dislocate joints. So this means that for many, many years, I was misdiagnosed or incompletely diagnosed, and I had to figure out for myself that I had Ehlers-Danlos Syndrome. And since my diagnosis, which was around the time I had my vascular compressions looked at in October of 2020, I have been joining a lot of Zoom support groups. I've met an amazing community of people with Ehlers-Danlos Syndrome, all presenting very differently. The most common type of Ehlers-Danlos Syndrome does not have a genetic test available at this time. However, they are making discoveries. In South Carolina, they did find a gene responsible for what they're saying hypermobile Ehlers-Danlos, which is the most common type. I don't believe there's going to be simply one gene involved in these syndromes. I think they're going to discover many, or everybody with EDS having a different mutation or some other mutation with one of the many genes that involve collagen production and synthesis. Collagen is a very important molecule in your body. It encapsulates your organs. It shields your organs from pressing onto each other. It makes up skin and blood vessels. And if your collagen is hypermobile, it causes pushing and pulling, and most importantly, neuropathy. So a lot of people with Ehlers-Danlos Syndrome have extreme nerve pain. They have gastrointestinal issues. They have cardiac issues. They have dysautonomia issues, which goes along the lines of cardiovascular issues. There's a lot of different issues, most importantly, joint dislocation. I am not one of those people who dislocates joints, so I'm a little bit different, but everybody's comorbidities are different in the way they present. And even people with the same type of EDS can present very differently from one another. So even if if 3 or more people have the same type of EDS, they may have very different severity of symptoms and very different comorbidities. So luckily for me, I am at worst moderate, sometimes severe. I'm not really a severe case of Ehlers-Danlos. However, from October on out, I've met a lot of professionals who agree with the diagnosis. They aren't specialists in Ehlers-Danlos Syndrome. However, they do agree with the diagnosis. I'm shifting my blog and my vlogs to more of a life with Ehlers-Danlos project. I do appreciate all of the pelvic pain warriors and all of the people with pudendal nerve issues who have followed me through my journey. to get to where I am today. Had I not had the decompression surgery, I never would have found out about my Ehlers-Danlos Syndrome. And I do believe that a lot of people with neuropathic pain should explore connective tissue disorders as a probable cause of their pain. Ehlers-Danlos is only one of many connective tissue disorders. You do need to get genetically tested to determine which connective tissue disorder you have, to rule out all the ones that can be ruled out. And if nothing shows up, more or less you have the type of EDS that's most common, that does not currently have a genetic test. Hopefully down the road they will discover more and more genes involved in this disorder so that they can properly diagnose people and perhaps come up with more types of EDS. Currently there are 14, to my knowledge, 14 types of Ehlers-Danlos syndrome. The other thing is I did submit a DNA sample for whole genome sequencing. There's a couple of different genetic tests you can do. Whole genome sequencing pretty much looks at the entire human genome, all of the genes that they know what codes for what, and that they can determine, there's 5,000 or so disorders that they can check for, and I'm going to probably be told if I'm carriers of things or what have you, to possibly rule out other things that I may have missed, such as a metabolic disorder that I might not have known that I had. I submitted my sample in early April and they told me my sample was unusable, so I had to resubmit the sample. So it's taken a lot longer than I previously expected. So I'm looking at possibly end of September, early October for them for me to have a genetic counseling appointment once they get my results. In April, I did have another lumbar MRI that determined I have foraminal stenosis and facet arthritis in L1 and L5, a mild version. But for someone my age, that's not something that I should have, which is another thing that's common in Ehlers-Danlos syndrome, musculoskeletal issues such as that. But I am not going to move forward with pain management or anything else of that nature at this time, because I'm letting my body heal from all these procedures that I've done so far. I am taking a break with doctors. I think I've come as far as I can with specialists, and most of the specialists don't know how to help me at this point. It's just basically about medication and symptom management. So right now I'm only taking medication and doing physical therapy at this time. I'm not going to be seeing any new specialists anytime soon. However, in May of 2022, I have an appointment with Dr. Claire Francomano. She works with the Ehlers-Danlos Society, and she is one of the, she publishes a lot within the Ehlers-Danlos Society, and she specializes in hypermobile disorders, and she is located in Indianapolis, Indiana. So that was an appointment that I had to wait for months and months to get into to see her. So I am very much looking forward to meeting her. And while I may not be able to continue treatment with her, it would be nice to have an official, on-paper, stamped of approval from a professional, one of the top in the world, in my opinion, for Ehlers-Danlos syndrome. The other doctor was Dr. Brad Tinkle. He was also in Indianapolis, Indiana, but bless his heart, he had a stroke recently, so I am sending love and prayers to him and his family for getting through this hard time, and hopefully he has a speedy recovery. So that is where I'm at today, 1 year, 5 months post-op. I'm going to probably start or continue doing my video updates, just not as often. I do realize I've been talking for a good 15 minutes, so if you're new, I really appreciate you coming to visit me and all of the support. I've gotten a lot of DMs and Facebook comments from people who have watched my previous videos and who have followed my journey. And I just want to say thank you so much for following me and commenting me on my stuff. It really keeps me going in times when I was barely hanging on, that I didn't think I would see a light at the end of the tunnel. And it makes me think that I'm doing the right thing by telling my story and that I found my calling. So thank you so much to everyone who is watching, and I hope you all have a fabulous and pain-free day.